Do you know your body is the smartest doctor? For that reason, pay attention to the signals your body is sending. Some time ago, a lady walked up to me. She said, Doctor, imagine what I've been passing through for the past few weeks, doctor. Doctor, please help me. That is why I came. You can see my breast. Most of the time, when I touch my breast, there is always milky discharge coming out, and it is giving me worries. I find it difficult to meet my man because I'm experiencing vaginal dryness. I find it difficult to take in. I don't know if I'm already infertile, doctor. Imagine me. Doctor, it is only me my mother has. Doctor, menstrual disorders, today I will see it, tomorrow I will not see it. It's becoming irregular. And how will you call me a woman when I'm not seeing my periods? Doctor, headache, hot flashes every day. Doctor, please help me, Bikunu. Doctor, help me. You've heard all our complaints. Now the question is, what actually went wrong? The medical condition for this is called hyperprolactinemia. This indicates a high level of prolactin. Now, what is prolactin? Prolactin is a hormone that is responsible for the production of breast milk. That is why you see some of these pregnant women or women who are breastfeeding, they have this high level of prolactin to enable the breast milk to be produced. When there is hypersecretion or too much secretion of this prolactin in a lady that is not pregnant, in a lady that is not breastfeeding, what happens? These complaints you see. You may experience menstrual disorder or irregularities. You may experience vaginal dryness. You may experience pain during intercourse. You may experience discharge from the breast, especially uncontrollably. You may experience headache, but this is less common. Then for women who are postmenopausal, you may experience hot flashes. What are some of the causes of these symptoms? One of the causes is called prolactinoma. Now, what this means is a growth or tumor in that part of the brain that is responsible for the hypersecretion or hyperstimulation of this prolactin. Now, once there is an abnormal growth there, what happens is you begin to see hyperprolactinemia, which is the high prolactin level in the blood. Outside that, one other thing that can cause it is medication. Medications used for high blood pressure, medications used for nausea or vomiting, medications used for someone who's treating gastroesophageal reflux disease, which is GERD, birth control pills, medications for someone who's postmenopausal, who's already in menopause. So being on these medications, even for pain relievers that contains opioid, these medications can result to high prolactin level in the blood of a woman. Now, what's the way out? Surgery. If you're having these prolactinomas, that's the abnormal tumor growth in the part of the brain responsible for the stimulation of this high prolactin level. One other way is medication that can actually reduce the level of the too much stimulation of this hormone. One other ways with which you can actually tackle this is the use of supplements like Spidex 20. Now, I want you to recall that hormones is what determines the body of a lady. Once anything goes wrong with the hormones in a lady, a lot of things goes wrong. But once you're able to balance the hormones, things come back into play. So with Spidex 20, you are able to balance the hormone that is responsible for the hyper or high secretion of this prolactin, resulting to eradication of all of these complaints. Lastly, I want you to always, as a woman, this is to all the women, always examine your breast. It is very important. It is called the breast health examination. Always examine yourself to check for lumps, to check for discharge, to check for the texture. Look at the colors. All of this can actually tell if you are having good health. So once again, as a lady, do not ignore your body signal. This is very important for ladies. Thank you.